I'm Scott Schaaf. I'm an orthopedic surgeon at the Everett Clinic. I'm also a chief of surgery and medical director for musculoskeletal services. I oversee all departments that are related to bones and joints: rheumatology, physical therapy, podiatry, orthopedics, our spine center, hand center. I grew up in Chicago, in the suburbs of Chicago. I went to college at Hope College in Michigan. I did my medical training at the Chicago College of Osteopathic Medicine, and I did my residency there as well. There's two reasons why I became an orthopedic surgeon. One was at Disney World. I saw a little girl on crutches, and it really made me sad, and I really thought that I would want to help her. But growing up on the south side of Chicago and working in the trades to pay my way through school, I became proficient with drills and saws and whatnot. And first time I was in surgery, my mother's a surgical nurse. She snuck me in college at a teaching institution where they were used to students. I saw an orthopedic case that had drills and screws and plates, and I thought I could do that, something I grew up doing anyways. So it was just natural for me to end up in orthopedics. Why I chose to practice at the Everett Clinic. For one thing, their reputation. They have an excellent reputation in the area. And when I had first moved to Washington State, I was working at the small hospital up in Arlington. And I was looking for something that was a little bit bigger, that was a little bit more secure. And honestly, Dr. Frost, who's also in our department, asked me if I'd like to join. And since I had a lot of respect for him and he's an excellent surgeon and a good friend, I thought that that would be a good fit for me as well in that department. So not only the security and the size of the clinic and the reputation, but also the camaraderie I had within my own department is what led me to join the Everett Clinic. How many procedures have I done over my career? We average probably about 600 to 700 a year, and have been doing this for 12 years, so pushing 8,000, 9,000. What is my specialty within the department? I'm a generalist in that I do a little bit of everything, but where I tend to lead my practice more has been in the upper extremity, from the shoulder to the fingers. There are some procedures in the wrist that I do that's unique for me. Wrist arthroscopy is one of them. So mostly the upper extremity. What I'm most proud of in my career are probably two things. One is when a patient comes up to me on the street, or even a patient comes up and says, so-and-so recommended you highly. And it's even more basic than that. It's sometimes just the fact that you've made a connection with someone, even if it's not so much the surgery you did, but they said you're a nice guy or that you're easy to get along with. I did receive an award from the Seattle Metropolitan Magazine for one of their top docs, and what means the most about that is it is peers who said if they had to have treatment, who would they choose, and they picked me. So that to me meant a lot. That means that people would trust me with their family, and that means a lot.